Here's a shift worth noting. Better healthcare is care that meets patients where they are. United Health Group is bringing it directly to living rooms. This is a win for patients managing chronic conditions. And here's the interesting thing. By closing those care gaps, administering in-home exams, and identifying risks earlier, more diseases can be prevented and patient outcomes can improve. In 2025 alone, United Health Group patients received over 19 million home visits. Learn more at unitedhealthgroup.com/commitment.
We know life is busy. That's why saving money should be effortless. With Atlantic Union Bank's Roundup Savings, every time you use your debit card, your purchase rounds up to the nearest dollar and automatically goes into savings. So whether you're grabbing coffee, filling the tank, or picking up groceries, you're saving without even thinking about it. It's just one of the ways Atlantic Union Bank makes managing your money easy. Learn more at atlanticunionbank.com or stop by a branch today. Atlantic Union Bank. Any way you bank.
If you've ever thought about getting into running, you've probably heard the warning that it will destroy your knees. People fear that the high impact of the sport will cause wear and tear, putting you on a fast track to osteoarthritis. Well, I have good news. That's all a lie. Dr. Thomas Buchheit says this myth stems from our early understanding of the difference between rheumatoid arthritis and osteoarthritis.
Rheumatoid arthritis is known to be inflammation that's just out of control, and osteoarthritis, because it wasn't as inflammatory, was thought to be, well, it's just a result of too much wear and tear, too much weight, other things that drive joint damage. But it turns out it's just not true. And there are multiple studies now that show that exercise actually keeps joints healthy. There have been a lot of studies looking at walking and brisk walking that is good for arthritis pain and actually is good for arthritis cartilage.
Buchheit is the director of the Regenerative Pain Therapies program in the Duke Center for Translational Pain Medicine. He dives into our body's natural healing processes in his new book, Healing Joints and Nerves, Immune Stimulation and the New Science of Regenerative Therapies. Buchheit believes we've wrongly villainized inflammation in an effort to treat osteoarthritis.
After the wear and tear hypothesis kind of started to wane a little bit in its popularity, people started thinking, well, maybe osteoarthritis is an inflammatory problem. So let's do things. Let's use lots of anti-inflammatories like NSAIDs. Let's do steroid injections to suppress the inflammation. We can also use these powerful rheumatoid arthritis drugs that strongly suppress these inflammatory proteins. And it turns out none of that works. None of that works long-term to improve the health of the joint. They work short-term to suppress inflammation and improve pain. But actually, sometimes they're doing more harm than good.
We all know the typical protocol after a sprained ankle: rest, ice, compression, and elevation. But new findings show that this go-to method may actually be the worst thing to do for healing. The dangers of chronic inflammation have wrongly influenced how we react to short-term inflammation.
Chronic inflammation is nearly always bad for us. It damages tissues, it drives arthritis, it causes chronic pain. But the challenge is a lot of us have kind of thrown out the wheat with the chaff here, and some inflammation can be very good for us. Acute inflammation, short-term inflammation can be very good, and it's necessary for healing. For instance, if we have a cut, a sprain, or a fracture, we need inflammation to start and promote that healing cascade. And one of the challenges is that we've gotten so used to suppressing all inflammation with anti-inflammatories, with steroid injections, that we're turning off a lot of these natural healing mechanisms.
Studies have shown that people are more likely to have a faster recovery from injury if they have a strong inflammatory response. Sometimes patients with joint problems are given steroid injections to reduce pain by getting rid of inflammation. Unfortunately, this only provides short-term relief. A 2017 paper in JAMA tested this over the course of 2 years by injecting one group of participants with steroids and a second group with saline every 12 weeks.
And those who had got the steroid injections really weren't any better off pain-wise. Not a big surprise, because most of us know that steroid injections tend to do short-term improvement, but not necessarily long-term. But those who got steroid injections actually had less cartilage in their knees. So in fact, we learned at that moment that these frequent steroid injections that a lot of us were using to treat arthritis pain might actually be worsening the problem we were trying to treat.
Buchheit and others in the field realized they needed to rethink how they're treating osteoarthritis by reframing how they viewed the condition. Instead of treating it as an inflammatory problem, Buchheit began to think of arthritis and nerve injuries as chronic wounds.
A chronic wound does have inflammation, but you don't suppress the inflammation to treat it, right? You treat the wound and then the inflammation gets better as the wound heals. And as we start thinking about it and thinking of the therapies, how do we heal a wound? How do we heal a sprain? How do we heal a joint? All these mechanisms kind of come together. And that's what I like to talk about in the book, is how our built-in healing mechanisms we are really needed to treat things like conditions like osteoarthritis, and how to kind of enhance our natural healing mechanisms.
Instead of fighting inflammation, we need to figure out how to resolve it.
Fighting inflammation is we're taking a medicine or having a drug that shuts off our natural immune process. Resolving inflammation is we're actually doing the opposite. We're turning on our body's own healing mechanisms. We resolve inflammation with exercise, which is inflammatory when we exercise. As a matter of fact, if anybody goes out for a high intensity workout, they're going to be achy probably afterwards for a day or two. We all kind of know that feeling. And those are those immune processes, those healing mechanisms that are getting turned on.
The benefits of exercise are twofold. First, the mechanical movement enhances tissue nutrition by boosting blood flow and increasing waste removal. The second benefit is that the short-term inflammatory response turns on proteins called cytokines. While they're often blamed for causing excess inflammation, exercise stimulates a certain type that promotes healing.
So you have spikes in cytokines. For instance, IL-6 can go up 100-fold after exercise, and that's a known cytokine associated with chronic inflammation and everything else. But that spike of IL-6 will turn on all these downstream natural systems that resolve inflammation and strengthen us. A lot of, even in the exercise literature now, people are starting to refer to this cytokine, IL-6, as not a cytokine anymore, but an exerkine, trying to rebrand it as it's good for us, and it is good for us. And so we need that stimulus.
Which is why taking an anti-inflammatory before a workout impairs that tissue rebuilding process that should happen after exercising.
So we need that stimulus. The next part of exercise, though, is it also releases these tiny immune particles called exosomes. And exosomes are kind of instruction manuals for cells. Exosomes will teach a cell how to behave, and they'll actually reprogram how cells behave and can make them more youthful. So our bodies release exosomes with exercise, and those exosomes can improve tissue health also.
Buchheit calls this process the healing cascade. Ideally, the injury attracts white blood cells to the area to clean up and prepare the injured region, which is when inflammation occurs. Then, other immune cells come to repair the damage and resolve the inflammation. Unfortunately, the process can get stuck in the first stages, and it needs something to kickstart it back into action. That push can be exercise or even your diet.
You can almost think of it, what's good for your heart is also good for your joints. But you can change the inflammatory signal, and you can decrease chronic inflammation with these good kind of healthy fat, healthy food diets. And when I use the phrase healthy fat, what I'm referring to are things like olive oils and avocado oil and nuts like walnuts and leafy green vegetables and fruits and fish, things like that. So those are the kind of healthy fats I'm thinking of, the omega-3s and then the monounsaturated fats like olive oil and avocado oil. So those can help decrease the chronic inflammatory changes, and they can promote healing.
Our bodies use these healthy fats to create the lipids that resolve inflammation and decrease pain. And though exercise is a crucial component of kickstarting this healing process, the initial inflammation can be painful and make it difficult for some people to move their bodies. This is where steroid shots can be really helpful in providing enough pain relief for the person to start working out.
Sometimes a steroid injection, a single steroid injection, I think can be helpful to get people moving again. To me, that is the power of it, is if it helps somebody return to function, return to the gym, that's great. And the caution I share with people is that it's the repeated use of steroid injections. 1 year, one every couple years is probably fine. 4 a year is probably too many. And somewhere in between, it's a bit of a gray zone. But if that injection gets them moving again, I think that's fine. But if it's used repeatedly because they can't get moving otherwise, then we really need to start thinking about these other therapies that kind of flip that immune switch and hopefully promote that healing cascade.
In addition to steroid shots, other regenerative therapies can also help flip the switch.
You want to take their immune system and give it a stimulus and flip that switch. And that switch flip will begin this resolving inflammation process. And so it's really a booster in a lot of ways. And things will do it. Platelet-rich plasma does it. Autologous conditioned serum does it. Stem cells do it. They all help to basically turn the corner for a lot of these joints. So they may not, actually none of these therapies, none of the regenerative therapies will grow new cartilage, but they'll improve the health of the cartilage that's already there.
All while helping your body to finish its healing process. To put his research to the test, Buchheit followed this protocol after tearing his meniscus for the second time. With the first injury, he took anti-inflammatories as instructed for several months. And though it was a very slow recovery, Buchheit was able to get back to his active lifestyle. The second time around, though, he decided not to use any medications that would block the inflammation.
So no steroid injections and no anti-inflammatories. And it is true, it hurt quite a bit. It hurt quite a bit. I hobbled around for several weeks. But my recovery was faster. And I was skiing within a month of it happening. Now, again, I still had a little bit of discomfort for that month. But I was back to full sport and full activity fairly quickly. And so I think that it was a nice, it was an N of one experiment, right? And I had a similar injury 2 different times. But the second time around, my recovery was faster. And I am convinced it was faster because I let kind of those immune mechanisms turn on and do their work. And I didn't suppress them with anti-inflammatories or steroids.
Despite Buchheit getting back into skiing so soon, there was still some lingering inflammation that signaled the injury wasn't yet fully healed. Knowing he needed something to stimulate the healing cascade, Buchheit decided on autologous conditioned serum. ACS is a method that takes blood from a patient, stimulates white blood cell production, then injects it back into the injured area. It releases the proteins needed to resolve any existing inflammation.
So I had an injection done of autologous conditioned serum by a colleague and friend in Germany who does a lot of it, and who taught me to do it years ago. And I do this therapy as well, but I didn't want to do it on myself, so I had a colleague do it. And it worked quite well. I think it was what I needed to kind of flip that switch, and that was 2 years ago now.
Buchheit's book, Healing Joints and Nerves, is available now wherever books are sold. You can find more information about Dr. Thomas Buchheit and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our executive producer is Amira Zaveri. I'm Kristen Farrah.
Coming.
No two businesses run the same, so banking for your business shouldn't be one size fits all. That's why Atlantic Union Bank offers knowledgeable guidance and tailored solutions designed around your goals. Whether you're managing cash flow, moving money, or protecting your business from fraud, we make banking for your business both personal and easy. Visit us online at atlanticunionbank.com or stop by one of our local branches today. Atlantic Union Bank, any way you bank.
At Nature's Bounty, the belief is simple. You already have a brilliant body. Supplements just help support your journey. For over 50 years, Nature's Bounty has offered vitamins and supplements to help you eat, sleep, thrive, repeat. From magnesium glycinate for heart and muscle support to hair growth capsules for fuller, thicker hair. And probiotics with 20 billion live cultures for digestion. Nature's Bounty. It's in your nature to thrive. Learn more at naturesbounty.com. These statements have not been evaluated by the Food and Drug Administration. These products are not intended to diagnose, treat, cure, or prevent any disease.